Hi, my name is John Gibbons, and today we're going to look at a test known as the Stork test. It's also known as the Gillett test or the Gillett test. And the idea of a test is when you ask your patient to stand on one leg and lift their knee up towards their chest, then the thumb will come onto a fixed point of the S2, and then the opposite thumb will come onto the inferior part of PSIS. And if he stands on his left leg, so the left leg is obviously the stable side, we're looking to see if the PSIS is able to rotate inferiorly and medially. So that would be known as the Stork test. So for instance, if he has a dysfunction on the right, and it's say slightly anterior, or maybe if it's sheared forward or flared, then you might notice a restriction into that sort of posterior movement. So let's have a look at that. So find the PSIS with both thumbs and apply one thumb onto the S2, so that's the fixed point, and then the thumb inferior, without using too much pressure, so lightly palpate the PSIS and come inferior to that. Okay, Jack, can you slowly stand on your left leg and lift your right knee up to your waist? Okay, and you're looking to see if it comes down and in. Okay, and back on that right leg again. Okay, now swap sides, and now we go into stand on the right leg and lift the left leg, and we're looking to see if it comes down and in. Alright, let's do that again. So back down. So we'll do the same leg, Jack. So lift your left leg. Up we go. So left leg up, and you're looking for the thumb to come down and in. Alright, so medially and inferiorly. Back down, please. Good. And then you do it 3 or 4 or 5 times until you have an awareness of the motion on both. Okay, and back down again. So let's do the other leg. So right leg up. Good. So you're looking down and in. Relax. And the other leg, please. And down and in. So we have posterior motion of the ilium on the sacrum, and that would be known as the Stork test or the Gillett test.